unless we take additional precautions and gather more information and move cautiously and slowly, that we won't be prepared for a second wave.
The head of the Canadian Medical Association says Canada needs more testing, more contact tracing, and more PPE to be ready for the second wave of COVID-19. Dr. Sandy Buckman says all that will give Canada a better understanding of coronavirus and how it spreads.
We need to understand better what the exposure of frontline healthcare workers have been. We need to understand what if grocery clerks are becoming infected because they're exposed to large numbers of people, or transit drivers. So those occupations that are high risk.
Buckman gave the same warning to Canadian senators Wednesday, adding that testing and contact tracing also need to be expanded. The CMA also says Canada needs to secure more PPE for healthcare workers, especially as fatigue and burnout set in.
Doctors and healthcare workers at the best of times experience high levels of burnout. We did a survey about a year and a half ago that shows that despite high resiliency, about 80% of doctors reported high resilience. Approximately a third of them were experiencing significant burnout.
Mathematicians studying pandemic models say COVID-19's first wave resembles the Spanish flu of 1918 and 1919, which crossed the globe in several waves.
There was definitely a second wave. In fact, the second wave was about 4 to 5 times larger than the first wave. Our first wave and their first wave are looking very similar in terms of how they've gone. So that says to me that there's probably going to be a second wave, and it's probably going to be much worse.
I think that we have a range in our optimism, and maybe it comes from my personality. But, I think coming into this, when people were saying that we're going to see 50, 60, 70% of people get COVID in the first months, I said, I don't think that's going to happen, because as it goes up, people are going to see what's happening around them and really clamp down. It's not destiny. It's in our hands. And I'd also say that we've done it. We've flattened the curve, so we've shown we can do it. And now the question is, can we can we do it and be smart?
Now, the models are only as good as the data we put into them, so experts say we'll have to do a lot better at testing and contact tracing to better understand and forecast the future of COVID in Canada. In Ottawa, Xiaoli Li, City News.